Yeah.
Brought everything but my wits. I left them at home.
That's good.
I'll leave these for tomorrow.
Was there also a girl?
Oh, I think okay. Watch the cord. I couldn't do that. Just asking.
Thank you.
I agree, Mark.
Well, I can't hear nothing.
Yeah, well, that's two of us too.
I'm actually gonna like stand.
It's just a little bit after 4, and I'm gonna call the Health and Human Services Committee meeting to order. If people would stand, please, for the pledge of the flag. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I will note that we have all committee members here, legislators Jonathan Anna, Stephanie DeVito, Hans Petcher, and Mark Strong. We have minutes to approve for June 5th. Do I have a motion?
Second.
Any discussion? Questions? Hearing none. All in favor?
Aye.
Any opposed? Carries. We have no appointments to consider. We do have a presentation by Dr. Sherry, the Health Network.
Well, that's nice.
Yep.
Thank you. Thank you.
Thank you.
Good afternoon. Thank you so much. I'm Dr. Sherry Weiss with ACEP. I'm the Executive Director for the Cayuga Community Health Network and the Board Director of Housing and Street Outreach. And we wanted to request to come present to the committee about the street outreach and advocacy program that has been funded for the last couple of years. Some updates. Oh, sorry. We wanted to give some updates to the committee about where we're at. Who has the computer for the? Over here. Oh, okay.
Sarah.
Thank you. So next slide, please. So I'm going to start a little bit of history, and Nicole and I will just go back and forth. So we started in October of 2021. It was funding that was split between the city of Auburn and the county to look at piloting a street outreach and advocacy program, really designed to help figure out what is the homeless population needs, trying to meet those needs, trying to help folks find housing and get connected to services. So we started with one outreach and advocacy coordinator, and that was Nicole. We added a second staff person due to the level of need and the number of individuals that we were trying to serve in 2023. And we also get a little bit of funding from the United Way and some other sources. Next slide.
Yeah. So when I started this position, back in it was late September, but it all started rolling in October. My counts were 21 singles. And as far as helping those individuals that were experiencing homelessness or at risk, that could have been their referrals to places, whether it was rehab, you know, if we had to get Section 8 applications in, anything like that to help get them back on their feet again. Then from January to December of 2022, it was 61 singles and 4 families. You'll see the number increase because COVID, when that officially ended and the moratorium got lifted, the numbers increased significantly. So I had more families, more singles. So the following year, 2023, it went from 4 to 13 families into 90 single individuals. And as of today, from January till now, it's been 21 singles and 2 families, and that's just the first 6 months. When winter hits, that number's gonna probably double. So winter's usually the busiest time, where people, are seen more often because they're trying to get out of the cold. Summertime, you don't see it as often, the homeless population. But again, we, have done a lot of work, a lot of, blood, sweat, and tears have been put into it. So we've housed quite a few people that are successfully being housed still. And we still have quite a few on the streets as well.
We also have, can you back up for a second? Sorry. We have 12 households that were at risk of homelessness over the course of this. So we don't just do the street outreach, we also do some prevention. Sometimes folks will reach out to us or someone will refer them to us about, hey, this person is behind in the rent, or there's a significant issue going on and we're not gonna let them stay housed with us. Sometimes people reach out on their own and say, I don't wanna be evicted, my landlord's threatening to evict me. So we've had 12 preventative cases where we've been able to avoid homelessness, help them get situated, work things out with the landlord, or help them through getting connected to services or programs so that they could stay in their home. To date, we have about 193 single individuals and 19 families that we've provided these services or referrals for, but it's important to note that there's probably just as many who get contacted, maybe get an advice like, this is who you call, this is where you go for the application. So a lot of times they might say thank you and don't want any more help, or they might refuse any of the services that are offered, and those folks we don't track. Also, on average, we could say really we're serving about 60 individuals and 6 families per year. Next slide. This is just some pictures of the first one on the left is one of the first homeless encampments in the winter that we came across. These next pictures are just more recent. Next slide. Just a couple more pictures of some areas where folks are congregating. Rural communities like this, they don't generally hang out right in the middle of the street. They're gonna usually try to be somewhere more less conspicuous, and try to just have some privacy while they try to figure out what their next steps are. Next slide. And so this is, as Nicole mentioned, and in your handout you can see it much clearer, but these are all the services provided. I mean, everything from rental applications, employment applications, navigating social services, getting connected to SNAP, getting connected to a Medicaid, first to help people get signed up for Medicaid or other health insurance, getting connected to WIC, getting connected to behavioral health, physical health, primary health care, dental care, navigating employment, where do you get clothing so you can look good for your job interview, how do you fill out an application, how do you do an interview. We also do financial literacy and help people make budgets and understand how their money works and how they need to figure out how to plan in order to be able to not only obtain stable housing, but maintain stable housing. Next slide.
So the average cost for 2023 to 2024, it's so tough.
Okay, actually, I'll do this because I know it by heart. So on average cost, a homeless individual has one of 2 choices, if you call it that, and one is that if there's a bed at the shelter, they can go into the shelter, and that is funded through county sources. It's also funded through some grants, but we only have about 15, 20 shelter beds. The other option is to go to a hotel, which folks will end up being sheltered. All homeless families, by the way, go to a hotel because there are no family shelters available. There are no shelters that house families in Cayuga County. But the cost of a hotel room can reach about $100 a night. For families, it could be more because you might need 2 rooms if you have a large family. And that's per night. And so if you want to just do the math on that, that costs on average about $3,000 a month for someone, for a single person who has to be in a hotel, and about could be as much as twice as that if you're talking about a family. So there is that cost. And we were saying that, with the number of folks we've been able to work with and get them moving beyond where they're at into housing, Before that, people would stay in the shelters and in the hotels for a significant period of time. On average, it can take, 3 months for someone to find something, but we've had people be there as long as a year. I mean, it just happens because they don't have the skills or knowledge or understanding of how to navigate things. And if you don't have someone working with you, helping you navigate that, it's a pretty slow process. You might get turned away from something, and if you don't know, no, call them back later this afternoon, call them back tomorrow. You might not know that. So you end up just being like, well, okay, I guess I'll try again another time. And so when you think about 1 month, if you think about, 30 people, think about the number of people we helped, I think we said like 60 individuals. If they stay one extra month, multiply that times $3,000, I think it comes out to almost $200,000 in a single month. That, can end up being the cost of individuals who are stuck in homelessness. But we do have some success stories that we want to share. This is where a lot of this has started to pay off. Next.
I won't read all of it, but I'll just pick one and then I'll do a recent one. So one of the big ones on there is the bottom. I had been working with a female who had 4 children and also 4 cats, who was in the process of losing her apartment because of the funding that she was receiving from CAT. She was at her capacity. So I did some digging for her. And we found what's called the mainstream voucher, which was through Auburn Housing Authority, which allowed her landlord had to do a couple fixing up of her apartment, was able to pass inspections and things like that. And so she now will be able to live in that apartment at 30–40% of her pay is what she pays into it. And this way her cats cannot be displaced, as well as her and the children, into a hotel. The cats would have been able to go, so those would have had been rearranged for a different setting. I also, when I first started this position, I had a male who was living out of his truck and he wanted nothing to do with any services. I worked with him for an entire year, relentlessly, and he actually was one of the first people to live over at Senate Meadows when they opened, and he's still there. So he's doing phenomenal. Recently, I had a mom and 4 children that had presented themselves as homeless at one of our hotels, but the mom had a 1250 voucher through Section 8. So I couldn't wrap my head why she was at a hotel with that kind of money, because that's like going great for an apartment right now. So once I had gotten her on my caseload, I was able to get her into an apartment within about a week. She was able to get out of the hotel. She'd been there for 8 months. When she had the voucher. The vouchers are only good for a year until they expire if you don't find something. And then the most recent one was a harder to house individual. And she had burned a lot of bridges with the hotels, just for whatever her own reason, not following rules, whatever it may be. And I had to pull a lot of strings, but we eventually were able to successfully house her. And one of the things I just want to put out there is that although these numbers are individuals I've worked with or families, a lot of them, even when they are housed, they still come into contact. So like they're still getting services, whether it's, if they're calling me to be like, hey, I have no food, what pantry's open, and I give them the numbers and the contacts. There's always, more than one contact with these individuals and families. One more slide.
Thank you. So we wanted to share with you budget because the county has been supporting this program since its beginning. But we've been able to leverage some funds so that we could have the 2 staff that we need. We need more than 2. When we talk about helping 60 people in a year, on average, there's at least 100 homeless individuals, and right now somewhere at least a dozen, if not more, homeless families, if I'm not incorrect. But there's a good number of folks. We're not the only ones out there doing the work, but we are the only ones out there doing the street outreach part of it the way that we're doing it. So we've been able to add a second person by leveraging some additional funding, and we have another staff member we're going to be able to add into this. But we do need help sustaining this. The county's been incredible, and we're very grateful. And we're not asking for some huge increase. Things have gone up in the past. The county has pledged $60,000 to work for this program. And we're asking for an increase. So just to show you the cost of the personnel, we have a director, we have full-time staff, we have some admin. program supplies are really minimal. We have a pretty reasonable fringe rate. Our rent and things like that, we have a cell phone, we have a computer, there's rent to pay for the office space, those kinds of things. So the total runs around $165,000. We're leveraging all the funding we can. We are asking for to be considered that the ledge helps continue support for $68,725. That is what we are asking. We're hoping that you can consider, if not all of it, some of it. We're doing the best we can to leverage what we can get our hands on, but I think the impact that we've had has been a huge cost savings to this county. And we've been very privileged to be able to deliver these services, and we want to continue to do it because we think we're having an actual impact that is not only helping the people, which is what we're really about, but it is also saving the county some money. Are there any questions?
Sherry, the increase ask in this budget then from the county is 8,725?
Yes. Believe so. 8,000. I think in the past it was $60,000 from the previous budget that we were approved.
What's your, oh, I'm sorry, I have a question. What's your ratio of clients, city, county ratio?
Really depends.
Yeah, I mean, we have, I would say more in the city of Auburn, but countywide, on average, I would say anywhere between 2 to 3 individuals a month I'm getting calls on, whether it's mostly, like I've had a few Fairhaven area that have been parked out at like the lakes and stuff. I've had a few in Moravia, or not Moravia, sorry, what's this?
Yeah, Mercy.
No, Union Springs, I apologize. Union Springs has been a big one. The goalie, a lot of people will be there. I've had a few that have transient into that area, but then we were able to get them a bus pass, something like that was easy enough to do because they weren't from this county. So we don't fund if they're not from the county, but a lot of it's in the city, but I do a lot with the county too, outside in the rural areas as well.
Any other questions from?
Full disclosure, the original 60 was an ARPA request.
Yes, it wasn't our purpose.
And there is no possibility of having this contract funded through the Department of Social Services or partially or through Code Blue or any of the funding.
To my
that
knowledge,
comes through.
no, the DSS is simply.
So I mean, you're here saying we're asking for a direct legislative.
Correct. Yeah, a direct legislative line, that would be ongoing.
And
So
at
it'd
one
be
point,
$68,000.
yes, at one point you had 60 from the city of Auburn, 60 from Cayuga County. That's not the case any longer.
No, and it's a very good chance that the city will not have very much, may have half that if we're lucky. That's what they're
And your
saying.
funding runs out
At the end of the year. I
okay,
think we'll go a
so
little bit into, this is for 2025, so we're asking ahead of the time because we're trying to leverage everything we can. We get, we just started, we're getting 28,500 from United Way. So that is helpful. If we don't get the funding, we get part of the funding, we'll lose at least one staff member, because we won't be able to sustain it. And that has a big impact on who we can serve and how we can serve.
this has never been a line item in the
Nope,
county's budget
never, no,
before, that you're kind of putting us on notice if the program is to continue,
yes.
you have to find some.
Yes, that's
Is that-
exactly it. That is correct. Yeah, if this does not get funded through the county, this program will come to an end and we will not be able to do what we've been doing.
Kind of eligible or? Yeah, I mean, if there's
Yeah,
a way.
I mean, I don't know what way, I'm just coming to for us, we're coming to ledge saying if there's a way through another line in the county, that would be awesome. That's what we're hoping. We've touched on, like, would we make this something part of prevention? But we haven't gotten to that point, and there's obviously a lot going on that wasn't good timing, but we figured now was a good time, 6 months ahead of
Put
the
it
end
on
of the
people's
year.
radar.
Let's put it on the radar, put it out there so that we can have conversations and maybe negotiate something.
I appreciate the work that y'all do. But I'll be very honest and blunt. I personally have a hard time with anybody that has to be in a hotel room for a year when somebody else is dying. If that's the case, then somebody's not doing the job. Plain, pure and simple. I mean, I can understand a month, maybe two, maybe three. Everybody's, at some point in time, everybody needs a little bit of help. But when it gets drug on to a year, I personally have a problem with that. And the program, if somebody's there a year, program's not working. If there's not an exit strategy for somebody, you know, at that 3-month time frame, and something needs to be looked at.
So the program wasn't in place when this was happening. That's one of the reasons why we're saying
But
we are.
you're
we are-
saying that there's still people there that have been there a year.
No, I can't speak to that. I'm saying that we worked with some of them.
Yes, the shelter allowance itself is too low and the
I will-
apartments are too high.
I will tell you that I don't disagree with you at all. I hate that they're in the hotels, probably more than you do. But I will tell you this, most of the people that I've successfully housed have been out of those hotels. So a good chunk of them I've worked with and we've gotten them. The problem is the connections with the landlords, affordable rent. That's what keeps people in these hotels. It's not necessarily their own doing.
Yeah.
Like I just said, I had that mom of 4 kids. She had a $1,250 voucher. I don't know why she was in the hotel for 8 months. That's crazy, right? But she was. I came in, I have landlord contacts and we got her out.
I mean,
It takes
I only
some-
know what I read in the paper. I don't have access to y'all's information.
Yeah.
But the paper, you know, had an article here this weekend, you know, they're talking about the 80-bed shelter. And they said, we spent $3 million putting people in hotels last year, or this year, or last year, sorry. I mean, that's not acceptable to the taxpayers of this county. We're beholden to them people and we owe them an explanation. And right now, I don't have one. I don't know if y'all do, but I certainly don't have one as to why that's happening.
You certainly are not serving everyone.
No, not at all.
We have a very small caseload of people that you.
Oh, it's not small though.
Well,
But for one person, no, it's not small.
but I mean,
Yeah.
all the people in
Yeah.
hotels, you haven't not solved the problem, not everyone.
No, this is not gonna fix the whole thing. I think a combination of the shelter is gonna definitely help. A larger shelter won't be a big answer, but that is gonna take a few years to build. And in the
Exactly, that's my
meantime-
point.
Yeah, and in the meantime, we're doing the work we can, but we're limited by the number of people we have. I know it might sound like, well, geez, there's 2 of you, why can't you do? Believe me, it's not a one and done thingy. There's not a couple of phone calls. It's hours of work. You have to understand their situation, you help them understand. There's education we have to do. Then there's the phone calls, the applications, understanding the process, helping them arrange transportation, it's hours and hours of work for just one person, let alone a family. So this is why it takes a lot of time and it takes, several people.
I'm only told, you know, I've had some folks mention numbers in previous meetings that we put 100 people a day in hotels.
Mhm.
At $100
We get
a
them out a
month,
little
or
faster.
$100 a day.
Yeah, but we get them out faster. Without us, if we go away, you'll be paying for those people. I truly believe that for,
And I know
Much longer.
this 80-bed shelter is at least a couple of years away.
Jonathan, did you? I'm sorry.
That's okay. I'm not gonna disagree with you. I'm just wondering if you keep any statistics or have readily available down the road to quantify the actual savings. So granted, the county share and this will be $70,000, but I feel like you should be able to quantify that and say, this is what we've done, and we've kept, gotten people out of hotel rooms earlier, and this is a dollar amount, and here's the dollar that justifies our $70,000.
in the presentation, there is a dollar amount there. I gave an example of saving around $198,000 if you just, you calculate the math. Now, I would have to sit down with Christine and we'd have to look a little bit.
Cost avoidance. That's right.
Yeah, this is it's sort of an extrapolation of saying if you have X number of people that we've helped and, let me see what page, I apologize.
It's on 7,
Page.
the average cost.
I go ahead.
Average cost, there we go. So,
And if you wanted it broken down as to, like, I could, on the side too, without disclosing information, I could show you how many families we've got now.
you guys have.
I can't see that. I'm sorry.
I apologize, the print is terrible, but the slide itself.
I've had my bifocal.
I got mine on, that's not helping. But if you think about the cost, just one person is $3,000 a month on average. If a person stays in a hotel for 3 months, that's $90,000. That's one person. And that might be the average stay, 1 to 3 months. Now multiply, but if somebody's working with us, they tend to get out a bit faster, sometimes a month faster, sometimes 2 or 3 months faster. Especially if their situation's really difficult, they have a very low housing allowance, they have a lot of other debts, or they have a lot of other obligations, maybe they have child support, they have other things that are gonna create difficulty for them. So on average, we get people out faster, I would say on average, at least 1 to 3 months per individual that we work with. If before we were here, doing any of this, people would be in those hotels for a lot longer. So if you look at the cost of that, figure $90,000, we're not even asking for 3 months worth of one person. And yet we can usually help between 60, the other 1 year we helped over 100 people. So this is why we hope that the county agrees that if we could figure out a way to sustain this, that would be very helpful to the community.
I just want to point out, you just said for 3 months stay for one person is $90,000.
I'm sorry, $9,000. I apologize. That is completely
I was gonna
incorrect.
say.
Sorry. Yeah, I should say, yeah, I'm doing my math wrong. It's $9,000 for one person, 3 months. Multiply that times the 60 people that we helped.
But again, if you put that at a year, that's 90,000.
Yeah.
That's probably twice at what most people, single people make in a year working.
True.
So I'm just being honest, I have a hard time with this program. I'm just sorry.
Any other questions? Comments?
Thank you.
Okay, thank you, Sharon.
Thank you guys. Thank you very much.
Okay, we have department updates. Kathleen Cuddy, want to come up and
Would you like me to give update prior to going to institutions or what would you?
why don't we do an update on each appropriate resolution first and take care of those resolutions?
So we have resolutions this month. There's a third one about backup that we'll get to last, I think, for discussion purposes. Our first request is to ask the legislature to approve us doing some budget modification within our WIC grant that is required. We're moving some funds that were in salary lines into other lines to be able to make a purchase, for example, of a security door that we need to do. We're not able to do that on our own like we are with some grants. This is a separate line in the budget. We have to come and get a resolution in order to accomplish that. Our second resolution is a request to fill program support specialist due to a resignation. We had an employee who accepted a position in another civil service area out of county. And this is a position that is critical to operating our WIC program. It is funded entirely through the WIC grant. Those are the two resolutions before we talk about tobacco.
Okay. I'd ask for a motion for HH1, authorizing the public health director to carry out a budget modification in the WIC program budget.
Make a motion?
Second?
I'll second
Is there any discussion?
Any questions, discussion?
I'd be inclined to maybe support this resolution, but without some facts and figures, hard facts and figures in front of me, I have a problem with it. In other
What
words,
would you like to know?
I'd like to know where the money is coming from as far as you said it was coming, correct me if I'm wrong, it was coming from some salary line items. I'm assuming that's unfilled positions.
In this particular case, when it comes to WIC, everything is completely within the WIC budget. So this was a federal grant received to us. So because we had some vacancies at one point in time earlier in the WIC funding year, we had some salary savings at that point.
So as you know, WIC comes from the feds to the state to the localities. And then with those vacancies, we need to get a security door for the safety of our employees. And
Yep.
so we were looking to try and make use of that funding to fund these security doors so that we don't need to take the money from another area of the health department budget.
And that's fine. I mean, I'm certainly not here to, micromanage your department, but, it would just be nice to, say, hey, look, we're going to spend X amount of dollars and stuff. I don't have that.
Oh, okay, it is in the resolution.
Okay,
The
thank you.
details of that.
Mark, do you want to see it?
I take your word for it.
Well, it's there, if you want to see it.
I'm just saying that, as long as that stuff is there,
Yes, we recognize that you all need to see that, so we try to always include that within our resolutions.
Any other questions, discussion? Hearing none, all in favor?
Aye.
Aye. Any opposed? I think it carries. I didn't hear from legislator Strong or
I
Patrick?
vote no. I'm in
No
favor.
comment. I think they're okay.
Oh, carries. Looking for a motion for HH2, authorizing the Cayuga County Legislature and the Public Health Director to fill a Women, Infants, and Children's Programs Support Specialist position.
I make motion?
I'll second it.
Any discussion, questions? This is a 100% grant funded position. I think it's important to always take advantage of our 100% grant funded positions, our grants, especially at this point.
I would agree.
Howdy.
I'm going to oppose it. Basically, most of these grant-funded positions tend to be permanent positions in a few weeks, years, or whatever. It just kind of grows more government, so.
Are we mandated? Is this a mandated position, this week position?
WIC as a program overall is not mandated.
Any other questions, discussion? Hearing none. All in favor of HH2?
Aye.
Aye.
Right.
Any opposed?
Yep.
Carries. Would you like to go back to the tobacco?
You mind if I give you a few updates, just figuring?
Oh, sure, absolutely. Right, that will make sense as we follow into the public hearing. Okay.
Great. Just, I didn't submit a written report. Timeframe for. Just a few highlights. As with all of our other county departments, we're adjusting our space and sharing it with some of our fellow departments, all of their resources. And I believe all of you received the letter we put together to share with our community partners, an email speaking about our new division directors who over the last 14 months. We have now had a complete turnover within our division directors through retirements, but I will reiterate, I think you've all heard me say before, I'm really pleased with the staff members who have been promoted, come in from the outside, who are learning their roles and the requirements and regulations that accompany that. As you know, there's a tremendous variety of programs within the health department, and we've got a great team on board. We've been very busy with our health education and outreach. We support farmers markets that are in Port Byron. We've been there. There's a Kids on Wheels injury prevention program that's going on. It's working with a number of the parks. Our Healthy Neighborhoods program is now working at Fort Canvassing in Port Byron. And we did some outreach at some other events at the skate park, ribbon cutting, our early intervention nights, the Booker T. Washington Juneteenth event, and working with Hill Family Medical at their men's health panel. Environmental health, this is, summertime is an exceptionally busy time for our environmental health division. Continuing to do a lot of water sampling and information sharing regarding hydrilla treatment, for example, on Cayuga Lake. Opening our children's camps, swimming pools, our bathing beaches. course, an exceptionally higher number of food inspections and permits, particularly because of temporary food trucks and temporary events. Ongoing conversations we're having with our State Department of Health regarding harmful algal bloom in conjunction with our water suppliers. And then of course, related to our rabies prevention, our drinking water safety, septic system plans, et cetera. We do have, we had some grant funding that helped us participate within the Our Town event, which is WSTM, comes to localities to do some public information and to, represent this catchment area. And our WIC program is 50 years old this year. So you'll see on WSTM some WIC commercials and some lead poisoning prevention, which we're glad to be able to share that in a different type of media venue with some really professional levels. Media videos, which is great. So we've got tobacco. I'm not sure how many of you saw too much. Our Board of Health has been speaking about, and I pointed to Elaine Lee, says on our Board of Health as a legislative representative, talking about updating our local tobacco law for a few years. We had some conversation over the last few years working with the county attorney's office and also working with Bond Schenck and King to review and update our current local tobacco permitting law with the idea that this will help prevent the ease in which many of the tobacco vendors, very largely our vaping vendors, are able to sell flavored vapes and sell to underage people in our community. So in New York State, it's age 21 in order to purchase tobacco products and vaping products. We have some information, I can kind of gloss it over. You did receive an email related to it. Ani Fish, our environmental health division director, is here. Deanna Ryan, our deputy director, is here. So if there are questions that we might have that Fred or I aren't able to respond to, they may have some good insights for you. We are required as a local health department to participate in the adolescent tobacco use prevention, which essentially, for ease of knowledge for people, I call it the sting operations for tobacco vendors. We have to go and inspect that people are properly permitted and they're not selling to underage people. And so we often will bring someone underage with us to see if they are able to purchase and or flavored vapes, regardless of age, are not to be sold in New York State. So we've had a number of situations where people have been in violation of that law. We go through our Board of Health hearing process. The hearing officer makes a recommendation to the Board of Health. The Board of Health passes an opinion. And often that is a fine and or points against your licensure. We have found that it has become more and more challenging to uphold for a number of reasons. One, the local permit is just one aspect. Vendors must have a state permit also. There are vendors who are not attaining their state permit and are opening up shops and selling without that. So that makes the state level repercussions more challenging. And also, frankly, some of the business owners are very clever, right? They know the process. They'll go through that. There may be $20,000, $35,000 fines. We've had as much as that. And they'll shut down their business, their LLC. They'll go out of business, wait a few days, open up a new business under a new name. We actually had one shop that shut down for a day, switched signs, and opened back up because they switched their LLCs on different addresses then. So it makes it, so then they don't follow through, right? There is not an effective manner in which to penalize them for selling to minors. We know that tobacco use, vape use, it contributes to long-term chronic illnesses and disease, all sorts of health issues related to both the user and people exposed to it. So we are hopeful that the county legislature may want to consider updating our tobacco legislation locally. There is no charge for vendors to have a permit. It really allows us to be more timely in the consequence. We clarified some definitions. We very much clarified vaping language. In some counties, there were vendors, some retail places who would not allow our inspectors, not in our case, I don't think.
Yes, we do have one
We just
place.
have one, okay, to even come in to do an inspection. And then there would be a surcharge that would be attributed to help cover the costs incurred by the county to do this work. So that's a very general summary of some of what we have proposed. The Board of Health fully supported this and the language within it. So now this is our first opportunity to formally talk about it. We've spoken very generically about this in the past. But now we want to be able to move forward with a public process, assuming the legislature supports that.
Any questions, discussion?
You said the permit, there's no charge, but what's the surcharge you referred to? What's that has to do?
If you have a penalty,
Okay,
so there would be a surcharge attached to that.
so let me ask you a question. There's administrative costs to doing all this, doing the inspections and being out there. Why is there no charge to the vendor if we're requiring them to have a license by law? I mean, I'm required to have a driver's license. I'm required to register my vehicle. If I want to go fishing, I have to get a fishing license. They all come with a fee. Why, having no charge, I don't think it has anything for compliance. I think it's kind of a courtesy, but there's administrative charge. Why have we not, has anybody thought about charging a small fee, whether it's 25 or 50 or $100 per license fee? I mean, truthfully, they're selling tobacco. It's not, they're making money.
Yes.
We're bleeding money.
So I can tell you why at the time, in 2013, that was the case. That was not the desire of the legislature at the time, in part so as not to put an additional burden upon retailers and ask them to have to take that on. And at that time, it was mostly tobacco sales. And overall, there's always, situations, but overall, most of the vendors were compliant. And at that time, there were 60-something vendors. So the sentiment of the legislature at that point in time was not to have a charge for something when they already had a charge to go through the permit process at the state level.
Sure. And how many vendors would you have now? You had 60 back then. Do you have, how many ideas you have now?
We have 55 now.
55. That's throughout the
And
county.
That is, yes, and that is inclusive of the 4 that were recently shut down. So as far as we know, there's still regulated facilities through our office.
Heidi?
Yes.
I have no problem with the law as written. I think it ought to be expanded a little bit, actually. One thing that bothered me, I helped write the law back a good many years ago. And what bothered me then is there's no punishment for those who try to buy. Shouldn't there be charges for the juveniles who are transgressing and buying too? It might be a good example for them. So, Fred?
Well, right now, the state law does not have that provision, and that would be a state law provision. There have been cases on that topic that make it a state law concern and not a local concern. The state law permits local legislatures to pass the licensing provisions, but it does not allow them to expand it as.
So we need state permission to expand it any further.
You need state legislation. Yes.
Legislation is what I meant, yeah. Okay, thank you.
The local legislation would allow us to look at currently the 55 vendors and charge it. And is it an annual update of their license or a one-time?
There's I believe it's annual or every 2 years.
It's a 2-year permitting
2-year?
term, yeah.
So you certainly could write that in, right? That is not included with what's proposed, but if that's the wish of the legislature, that's certainly something that could be considered, of course.
Mind if I add something?
Please.
So the state DTF, the Department of Taxation and Finance, they are who provide tobacco or nicotine sale licenses plus a vapor license. They run on an annual permitting schedule. I do believe one of the reasons we ended up with a 2-year schedule was to lessen the burden on our staff and how much effort we put into it when we're still going forward and doing all of our regulatory reviews in terms of inspections and stuff. Do I believe it might be easier to be on a 1-year schedule in line with DTF? Personally, yes, and if that's something that pleases you guys to think about, then go ahead. We're open to suggestions, I think. Fred, correct me if I'm wrong.
That's correct.
Because it's challenging when a facility's license expires for the state and they don't renew it, but they're still licensed under us. It makes it very, very, very difficult, nearly impossible to impose state violations to them, which is one of the reasons they say, oh, we can't assign points against their license because they don't have one. And that is one of the largest roadblocks that we've come in contact with.
If I may, so are they technically operating without a license?
Yes, they are, and DTF has failed to do anything about it, which is one of the reasons that we are here asking for the update to the local law, so we can maybe make a difference locally.
So are we still under the impression of a 2-year license instead of a 1-year?
I mean, it's up to you guys, we'll take your.
What are we asking for?
Well, the current law is 2 years, but what I'm hearing is it make it, well, I don't want to say less confusing for vendors because vendors know what they're doing. It's just they're working around the system. But it would make it more in line with everybody else. So the renewals come up annually, they both come up together and then it's enforceable together because when the state license run out, well, they didn't renew the county license either. I'm guessing if I'm reading the room right, you probably have to have your state license before you can get your county license if you follow that same platform.
Yes, however, if you let your state license lapse, you're still technically covered by the county.
Well, under 2 years, but if you go to a 1-year program, you can be in line and therefore you have more bite to your bark over here with the local law,
You'll have
right?
no argument from the health department
Okay.
asking for a 1 year, nor will you ask me for a fee.
Well, I think there should be a fee. I do.
I'm sure our Board of Health will be very pleased with
Yeah.
suggestions
Here's
as well.
what's available.
Okay.
Or you can wait to the fall.
Fred? What part of the proposed change in local law would allow the whereas change in these two pieces we're talking about? The 1-year relicensing and the surcharge.
You mean the permitting fee?
Right.
What you could do is if that's the will of this body, I could work with the health department, we could make the changes, and then the question becomes, do you want it available for Ways and Means and ledge this month, or do you want to have it pushed over till next month? That's a committee decision at this point, but we can make changes if that's what the committee wishes.
I know that I've talked with Department Head Cuddy, and she and the Board of Health are being proactive with this local law because of the sort of debacles and the slowness with the state. So I don't think they would be opposed to holding off so you've got the time to vote on this for next month.
Okay.
Because they're already ahead of the game by proposing this now, way ahead of the game.
Correct me if I'm wrong, Fred, but didn't you say it takes 2 meetings or 2 months to do
It'll take
this?
2 meetings, yes,
2 meetings.
because it's a local law. So the first meeting would be to set the date and time for the public hearing. There'd be a public hearing, and then the legislature would vote at that meeting.
Could I have advice on your ability, your timelines and your ability to create those?
In the back of my mind, I have the Board of Health, which has made recommendations. They haven't considered these two. Would you have time to go back to the Board of Health this month with these recommendations and see if they're in agreement? And then we can have the local law prepared for next month.
Certainly do that. Yes.
Okay. Okay, thank you for that,
Absolutely.
the honesty and that timeline. As a committee, are we all in agreement with,
Making the changes to the local law?
Yeah.
Absolutely.
Yes.
I am, yes.
Yes. We'll come back next month and we'll try to get you a copy of the update.
So we'll table this until next month. Is that possible? Or is
Right,
that
but
a thing to do?
We don't.
There's nothing to.
There's nothing.
Okay, so I just had-
No
just wanna
resolution.
make sure that we're doing the right thing.
Information only, yeah.
So I had one question. Any discussion on the amount of the permitting fee? Do you want the Board of Health to propose that,
I would love.
this
to make
body
that.
to consider it,
Make that
or do you have a
suggestion.
recommendation?
That's fine. I would let.
I would defer to Board of Health.
Yeah, I agree. Let the Board of Health, because they know what the state's charging.
Yeah,
What's a
let them
fair
make that
rate, let
decision.
them make the decision.
So we'll
And
come back next.
they know the cost of what it costs them to manage the program as well, a little bit. To a certain extent. You can't recoup that back. That's not what I'm saying,
Well,
but you have.
right, because
Proper administration fees should be.
we'll give consideration to what the hourly rate our sanitarians are that perform this. And we can certainly use that as a basis as well.
Thank you.
Thank you.
Thank you.
Thank you.
Anything else? Boris? Okay.
Thank you.
Lauren Walsh, I think she has representative today. Lauren's out of town on vacation.
I'm Maureen, I'm the deputy. So do you want our general update or do you want me to do the resolutions first?
Generally, what we do is if there are any updates related to the resolutions, you can give us those and then we take care of those resolutions as you're moving along.
Okay, perfect.
Yep.
In the update, you will see a synopsis of 2 grants that were recently acquired by Cayuga County Community Mental Health with Monica Salvage, who is our harm reduction specialist. Our resolution for this month is the GREEN, the Homeless Outreach and Peer Engagement Resolution, which we are asking to be able to receive those funds. Next month, there will be a resolution for the grant that we were awarded in the red.
So today's the hope one, correct?
Yes.
Next month's the keeping people alive.
Yes.
I have the black and white version.
Oh,
so-
sorry.
Okay, I just want to make sure I heard that properly.
Right. Yes, so the one that we have the resolution is for the homeless outreach and peer engagement today.
So we just heard a presentation about working with the homeless. This $600,000 grant you have, that's totally separate and does not cross paths with the presentation we saw today.
I was texting Lauren to get a better understanding of that. Just because I saw the wonderful presentation by the Cayuga Health Network, and I know there's going to be some collaboration within this grant with the Cayuga Health Network, but what's different is we are focusing on homeless outreach peer specialists. And peer being somebody with lived experience with substance use, with the focus of linking people from the hotels into more secure housing as well as the appropriate programming.
Do you want me to give them?
Yes,
Yeah, so-
you can rest.
Thank you. So yes, this is a position we will have additional people. So that's why we stated that what we presented to you is strictly is the program that we have that is not, in other words, that funding is for those individuals that are doing that work. This new funding, it's a 2-year grant. And it will include additional people, but they'll be focusing on a very specific population and they will be peer-based. What this is gonna allow us to do is be able to serve hopefully all of the folks that we've been dealing with. So this is, this particular one is a federal funding for 2 years, and it's not just us, it's work with DSS, it's work with health department, it's work with mental health. So this is separate from what we requested. So what we're requesting is basically would bring us to full staffing.
Okay. Could we put this on the table first to ask more questions?
Oh, yes.
Yeah, we never put it on the table.
So I'd like to get a motion for HH
I love
7.
it.
I'll second it for discussion. So and I hate to do this because Lauren's not here, but so we're talking about the $68,000 financing for the other program, is this grant restricted to where that?
This grant focuses on harm reduction and those who have been identified with having.
So it's strictly for like that drug money and self-harm money, and Fred's over here shaking his head yes too. So that's
Self-harm portion as opposed to strictly housing.
the housing portion. Okay, thank you. That answered my question.
We have it on the table. Any other discussion, questions from the floor?
Just one question. I saw the resolution when it was revised to include the creation of a grant coordinator,
A grant
a
assistant,
grant assistant,
Yes.
part-time, full-time?
full-time position.
Okay, can I assume that that full-time assistant is going to be working on the other grant that you?
No, they're two
No?
separate full-time positions. The program coordinator position that you see on both grants are both part-time. So the two grants will equal one program coordinator. And then once both grants are reviewed by the legislator, it could be a potential two separate grant assistants, one per grant.
So how many positions is mental health department going to be requesting to create to accept these funds?
For the homeless outreach, we're only asking for the grant assistant right now and the acquisition of the funds.
And later you'll ask for something different?
Yes, I think Lauren's going to expand. That was my understanding.
All 100% funded for the period time of this grant? Is that what it's just confusing to me. You see
Yeah.
positions created and I'm not sure who they're
Yeah.
going to belong to.
So the grant position, the grant assistant for both positions, for both grants will be a Cayuga County employee.
The mental health staff.
Yes.
Out of mental health.
Yes.
The grant assistant, what else?
I believe the program coordinator will also be employed under the county. Everything else would be subcontracted out with other departments, Cayuga Health Network being one of them, and as well as.
And there'll be two of each, one grant, two separate, because there's two titles under. both.
Yes,
So four hires?
3 hires altogether, 2 full-time grant assistant positions. And then the program coordinator is going to work between both grants. So they'll be working for the homeless outreach care engagement grant as well as keeping people alive. But we wouldn't be asking for that position until next month when we put the resolution in for accepting the funds for keeping people alive.
And all of this would be when the grant's gone, the program's
Yes.
gone?
Yes,
Is that
everything
even in that resolution?
everything should be budget neutral.
Well, I think that's the questions being asked. In 2 years, when the grant no longer is available and we fire somebody or their job's gone, how do you deal with that? Because that's right now you're telling us this is budget neutral, but it's only guaranteed budget neutral for 2 years. I think that's the concern looking forward, if I can, am I following you?
Yeah, that would be my.
Right, that's what I think she's saying is you're filling a brand new position or creating a position off of this grant, but the grant's only guaranteed for 2 years. At the end of the grant process, if the funds do not continue to come, we have a position that now we're gonna terminate.
My understanding that we would hire under the premise that it's a grant funded position and would exist at the life of the grant is my understanding.
And when the funds are done, they're done. Right? Is that what you're gonna say, Fred?
The chair had a question.
Chair had a question.
I'm assuming, attorney, that we've done this before. We've made amendments where we made it clear that the position is abolished when the grant is completed.
That language is presently in the 1, 2, 3, 4,
I mean,
fifth whereas clause. And it says, with the understanding that said position will be eliminated when the grant funding ceases. So the position would be abolished if the grant funding doesn't go beyond the 2 years. And the person that takes that job would know that limitation.
It's wishful thinking, basically, that it's gonna happen that way.
I can't speak to that. No.
Any other questions, discussions with HH7 on the floor? Okay, all in favor?
Where'd you say that was, Fred? I'm just,
Fifth.
One,
I
again,
counted
1,
down
2, 3, 4, 5. Fifth whereas, last sentence.
on HH7,
Let me make sure.
right?
Yes, HH7.
I keep missing.
Go to the bottom.
Very bottom. Oh, you're counting fifth from the bottom or on the second page? No, first page. I'm sorry.
Oh, good point. It's on the bottom of the first page.
Okay.
Good point. Second from the bottom on the first page of the
I
resolution.
found it now. Okay.
And then to
All right.
contracts, yeah.
So resolve, whereas that's what.
Yeah. Yeah, it kind of did because I didn't see it up in the whereas, but it's in the resolve.
Any other questions, discussion? Okay, all in favor of HH7?
Aye.
Aye. Any opposed?
Aye.
Aye.
Carried. All right, Maureen.
Then we just had a second resolution, just for a leave bank for an employee who incurred an unexpected illness and has reached has utilized all her accrued time. So we're just hoping to allow her to receive this leave bank.
And this resolution refers to HH8. I have
Sorry.
a motion to put this on the floor.
Move it.
Second.
Thank you. Well, this is a very typical resolution. We've done this just last month. Any questions about the lead bank request
Nope.
resolution? Any discussion? Hearing none, all in favor?
Aye.
Any opposed? Carries. Okay, any other updates?
Yeah, Lauren, just wanted to update the committee about the traffic that we've received in the clinic. As you can see in the updates that Lauren submitted, our billable visits were 2,774 both in April and June. Our overall census continues to increase. Each month, in April, we were at 2,170 clients with an increase in May and June as well. We just also wanted to provide a staffing update. We will have 3 therapists out on maternity leave as of this month, including 2 clinical social workers in the clinic, as well as a part-time social worker in the jail. And additionally, we just had a resignation this week. So I just wanted to provide a staffing update to the committee as well.
Thank you.
Thank you.
Right.
Thank you.
Any questions remaining for Maureen?
Thank you.
Thank you for covering for Lauren. Okay, so Christine, on up.
A little shorter. Ready to run through this time?
Yeah, why don't we
Okay.
put those out of the way?
I have 4 resolutions on tonight. HH3 is requesting to fill the caseworker position in the child welfare unit. This is a budgeted position. It is vacant right now due to someone that didn't make it out of probation. We had to make a decision to not retain that person during the probationary period. The position is a minimum 62% funded reimbursed position. And I guess what I want to talk to you about tonight, and this is not just for this position, but just to give you a little bit of a sense of kind of where we are in the process. So, I know I've talked about this before, and I've said a lot of things about what the services workers do, but I just, want to go over a few points just to keep it at the forefront, how important that work is. Critical services, obviously, that are provided to children at risk of or who are experiencing neglect, physical, sexual, or emotional abuse. The focus of the programs is on the safety of the children and supporting the parents in an effort to strengthen the family unit. Child protective workers are the workers that are charged with screening and investigating these reports that come in from Albany alleging abuse or maltreatment. These are people that live in our community that are struggling, and the workers from the department are the ones who are going in to help evaluate what's going on and help to determine what services are needed. We're talking about cases that some of them are very, very tough. We're talking about children that have been abused physically, abused sexually, there's emotional abuse, there's chronic abuse where people are living in homes that are not suitable for children to be living in. So very tough situations. So the workers when they go in and work with these families, are looking for what referrals can they make in the community to services that we have to help work on the issues. And they provide service supports to the families right in their homes. Sometimes we have to arrange for out-of-home placements of these children in foster families or with relatives or family identified resources, because they can't stay in the house because it's not safe for them to be there for a period of time. And hopefully we'll be able to work hard to get them back into their home, but sometimes that doesn't happen. And we have to look at longer term permanency solutions for these kids. Child protective services, foster care services, and preventive services are mandated. They have to be provided by regulation. The work that we do, the work that the caseworkers do and the supervisors do is highly dictated as far as like the services are provided by the state. We don't just get to decide like this is how we want to do things here in Butte County. We have to follow the regulation. The way that the services are delivered, the number of visits that are made to families each month, the information that we have to gather when we're on home visits, how we write up that information, how soon we write up that information, assessments, how we do them, how often we do them, how complete they are, all of that is regulated. Deadlines for filing in court, filing court documents, how often we go to court, all of that is regulated. We have audits that happen pretty frequently of our cases. They come in and the state comes in, we have federal audits, they come in and take a look at our cases and they make a determination on whether we're doing our job the way we're supposed to be doing it. And if we're not, there can be corrective actions plans, and in some cases there can even be financial sanctions. If our work isn't completed the way it needs to be, that it causes me great concern. And having the workers that we need to be able to do this work is paramount, really. Right now we have 70 children in foster care and foster homes. And we have 12 more who have been removed by family court and are placed with relatives in the relatives' custody. And then we have another 54 preventive services cases. And those are the cases where children are at risk of coming into foster care, and we need to be in those homes and monitoring to make sure that the children remain safe and that we can continue to have them stay in the home with the appropriate services. The workers that I have right now have about 20 cases each in foster care. One more caseworker is just coming out of training and will be taking cases shortly, but that 20 cases with the work that they need to do is too high already. It should be around 15. So they're already working with about 5 more families than they should be. And the caseload size that I'm talking about is not just something I'm coming up with based on what I think they should have. There's documentation for it. There's been studies on it. I can provide those to you. And that it's a comprehensive look at the work that needs to be done and how it needs to be done. And then sorting out like how many cases can a worker have within their work week and their month to be able to serve the families the way that we're supposed to be serving them. In child protective services right now, we have 6 caseworkers that have caseloads over 30. That's extremely high. They should be around 15. So overall right now in services, we're down 2 caseworkers. One was a resolution that I brought forth last month that was tabled. And then this one that I'm asking you to consider tonight. I'm down a senior caseworker position that was tabled in June. That worker left to go to the health department. So we lost a season, does supervision and takes cases on themselves as well. And I'm down a grade D supervisor position that I'm asking for you to consider tonight. And that worker went to Auburn Community Hospital to work for 1 week. So we have right there 4 positions that are all on services that makes me very, very nervous to be down that number of staff. And given what's happening with, the county's fiscal, situation, I just want to make sure that you have information that you need to be able to consider these positions. And my estimation is that these cases are about public safety as well. For public safety, I know that the sheriff mentioned that about being concerned about public safety. I'm concerned about public safety too. These are the most vulnerable people that live in this county that are children and also adults. So I didn't even talk about APS,
but they need our protection, they need our services, they deserve our services, and we're obligated to give them those.
Okay, I'd like to propose that we put HH3 and HH4 as a bundle.
I make a motion.
Motion.
The bundle.
I'll second it for discussion.
HH3 is a resolution to fill a caseworker position in the child welfare unit. This is foster care. Budgeted and 62% state federal return on funds. Any questions, any discussions? I'd like to talk, go ahead.
Well, I thought we were gonna bundle the 3 and 4, but.
Yep.
So I guess my question is right up front, at least one, if not both of these positions were brought in front of the legislature last month. And everything was tabled, any hiring was tabled until we had some sort of a report to decide on what we were gonna do about all the positions, not only these, but, you know, the 911, sheriffs, you know, there were several positions that we were gonna discuss. I have yet been privileged to a conversation as to where we were at, what we were gonna do with these positions. So I guess at this point in time, until we have that discussion, I would be not voting in favor of any of these. And believe you me, I understand fully well how much this is a public safety issue as much as anything. And everybody knows my position on public safety. But it was the vote of this legislature that said we were gonna table the hiring of all. And we have not had that discussion. And until we have that discussion, I don't feel it's fair to vote on any of these hiring positions.
Legislator Mark Strong, I agree with you, and I propose that we table these 2 positions. We need to be consistent with our decision.
Yeah.
Made just a few weeks ago, that we don't move forward on positions until we have a full budget review and understand where we are heading fiscally.
I as well agree 100%.
Are you making a motion to table?
Yes.
Is there a second?
I'll second.
I'd like to have, I am very understanding and very concerned about this being a public safety. And I don't want to take or make light of these positions. I think they're obviously needed. But I've made my statement and I'm going to stand behind it. But I want it to be known that, you know, I understand the need of these positions.
Any questions or discussion on the move to table?
We're tabling 3, 4, and 5. Is that my understanding?
Bundle 3 and 4.
3 and 4.
Is there
I would just,
5 and 6?
yeah, can we just
I have to
put them
read
all together?
Well, the motion was for,
Motions.
It's just for 3 and 4.
Oh,
Motions, yes, just for 3 and 4, the motion to table.
then we can motion 5 and 6.
Yep.
it's a different reason.
Okay.
I was gonna ask that question. Table till next month?
To the next committee meeting after we've had our legislative
I'm
update.
assuming,
Yeah.
correct? Are we supposed to be
So
getting?
technically, if it's tabling, it's still next month.
Okay,
If you're referring it, then that's different. But there's a motion to table on the floor at this point.
Any other discussion on that table? HH 3 and 4. Hearing none. All in favor?
aye.
Aye. Any opposed? HH 3 and 4 are tabled. HH 5, authorizing the commissioner to fill a paralegal specialist position in the Department of Social Services. Would you like to talk a little bit about this?
Sure. So this is a paralegal, full-time paralegal position that we have in the department that I'm asked to fill. We had a worker that has retired. And we actually have a candidate who is interested in this paralegal position that we think would be a good fit for the full-time position. The paralegal specialist is again, I'm gonna talk about critical nature of my positions because that's what I believe and I feel like that's my responsibility. I mean, the paralegal really keeps a lot of the paperwork and the scheduling and the management of the flow of all of the legal documents and court schedule, court calendar that manages all of the stuff that we bring to court. So when we talk about having, 100 children in foster care and other cases that are going to court for preventive services, that's a lot of legal work. We just filed in the last few months, we filed 15 petitions in family court. And there's a lot of work that goes into drafting petitions and getting all the needed documents that have to go to court and be processed through court within certain timeframes, communicating with court, communicating with the attorneys, communicating with the caseworkers about when we're going to court and just gathering up documents. There's a ton of discovery that we have that attorneys request about cases that we bring into court. So that attorneys have the documents that we're using to build our case. They're entitled to that, but it's a ton of work and the paralegal helps with all of that. Not having a paralegal gonna be crippling to us.
This is just a fresh opening, correct? You had a paralegal and they left, is that?
We had two paralegal positions in the budget, 2 full-time paralegal positions in the budget. Months ago, I had asked for a fill of the second vacant paralegal position and was given permission to fill, but we didn't have anybody. We didn't have any applicants for that position, so we weren't able to fill that position. This woman that was in the paralegal position, she just recently made a decision to retire. And just so happens that we have somebody that we are aware of that is interested in coming on board as a full-time.
But you're currently without a paralegal.
We're currently without a paralegal.
Could I,
He's already gone.
ask for a motion to put HH5 on the floor to continue discussion and questions?
I'll make the motion to put it on the floor.
I'll second it for discussion.
Thank you.
And without this position, without filling this paralegal position, that's gonna put, that puts continuous strain on your attorneys, correct? And how many attorneys do you currently have in the office?
I have 2 that are working, I have 2.
Well, remotely, but.
I have 2 attorneys that are social services attorneys and the supervising social services attorney just came back to work this week.
So you have the supervisor and two attorneys underneath them. Yes,
Well, there are also the 2 attorneys in the county attorney's office that are assisting,
okay, thank you.
just to round that out a little bit.
All right. Thank you.
Discussion from the floor.
If you already have one position that you could fill, why don't you fill this by bringing this here?
The permission to fill, so this is the other thing that's going on. So the paralegal that just quit, she's interested in coming back to work for us part-time. So we're gonna go to the Civil Service Commission and ask for consideration for her to be reinstated into the full-time position, but she would come back for part-time hours into
So
that.
she could stay in her position and work less than
Less
full-time.
hours. I don't think that a part-time position is going to be enough.
Mhm.
And so, but I'm kind of trying to figure out, like, if I use that spot that we have open and permission to fill with the lady that was left, then I'm not gonna be able to get in that full-time worker. If they get stable tonight. So I'm just trying to figure out like what the flavor is of
Right.
the legislature.
What's the best?
Right, what's my best strategy?
Poison? Because she could come back part-time now.
She can come back part-time and then I
still
feel
have a
like,
full-time need.
yes,
So I'd just like to say that you have 3 working attorneys,
correct.
and a paralegal.
Well,
Or losing the.
I have, right today, as of right now, I have no paralegal, and it would be up to the Civil Service Commission to make a determination on whether or not this individual could be reinstated.
Right.
Because I can't speak for them, but, I'm hopeful that they would be willing to do that. And then if that's the case, then she would be able to come back and work part-time hours in that budgeted full-time position, but not full-time. And then if that worked out, I guess just to add to that, if it worked out that I could hire her and have her work part-time, we would knock down that position in the 2025 budget to being a part-time position,
to do a 1.5.
to be 1.5, yep.
That was my question.
I'm just gonna finish up a
Go
second,
ahead.
then.
Absolutely.
with three, it was a long time before you were able to fill those attorney positions, and we had a great step up from our county attorneys.
Yeah.
I'm wondering, we're down by 2 people in our county attorney's office. This paralegal position, it's in the overall 2024 budget, would be better used by our county attorneys. Just offering that up for discussion.
So from my perspective, the paralegal position is better served in the DSS side of the house because there's a lot of work that gets done on the DSS side that isn't being done at this point. So that would be my only comment.
Legislator Strong.
My issues with HH5 are the same as that were with HH3 and 4. And my argument's the same. And I will not support this until at such time we have that conversation.
And, legislator.
I want to agree to that. And also number 6.
Okay, I'd like to add the 6 too to save time, but we're only talking about HH5 at this point in time.
I'm gonna be the lone dissenter on that then.
Maybe not long.
Okay, I'm gonna look at HH5 a little differently today, and this isn't about consistency either. It is about public safety. It's about getting stuff filed properly, because without court paperwork being filed properly, without someone there to run the paper back and forth and write it up and to send it out, to support the lawyers in this, we can't pull kids from houses. So if caseworkers have a bigger load, but this would put stuff to a halt, kind of like I look at the same way as the DA's office needed a stenograph. And we worked with that. I personally would prefer that you use the position you have now to hire the 0.5 and revisit this later. That's my personal opinion. So I'm opening the table with that, but from what I'm hearing, and correct me if I'm wrong, you're not even 100% sure the commission will allow you to do that. Is that correct?
I can't speak for them.
So how this one here, I'm reading this one here, and this one here, it's not talking about a part-time position either, though. It's also a full-time position. So why would this resolution be different than the one that we approved before with the opening spot? Would this have to go before the Service Commission as well?
The reason that that's going before the Civil Service Commission is it's because we're actually asking to reinstate a worker.
Okay. So either way, it goes before the Civil Service Commission.
That only for that one, it's actually for the person. We're
Right.
asking to reinstate that person, and then we have a position to put that person into.
Okay.
But we would put that person in part-time versus full-time.
No, I understand that.
Yeah, and then this one-
You could still do that whether or not this gets tabled or not. You still pursue that avenue?
Yeah, because I have permission to fill the other position, yes.
Okay, all
Yeah.
right. Then I'm okay with tabling it based upon that.
I'm worried that I'm gonna lose the person that is interested.
No, I
Because we had
understand.
such a hard time finding paralegals. We had 0 applicants, and I've got
Oh, you have someone on top of that you're interested in for the full-time position, is what you're saying, on top of the part-time. Okay.
Yep.
Anybody have a more?
Because you could always hire off of that one and not leave the part-time one for later. That sounds.
I agree with Mark. The other 2 positions, 5 and 6, should be tabled also. And what concerns me is the very state of the legislature. We're being laughed at all over the county. And this adds to it. Here we, proclaimed a great fiscal crisis. There was, my God, the sky is falling. And now we set certain goals and now we don't obey them. That's more of the BS, pardon the language, that's being filtered down and blamed on us. Thank you.
What are we, I would like to respond. I'm not sure what we're not obeying with the goals.
The very promise that was made by the full legislature that we're going to wait for fiscal reports before we do anything.
This committee hasn't offered a table. I'm waiting for an offer to table.
I moved to table 5 and 6.
Any discussions on the table?
Only 5 is on the table. There's
Only 5.
discussed.
We haven't,
You can make the motion for 5.
I'll second the motion.
thank you. Any discussion? All in favor of tabling HH5?
Aye.
Aye. So Mr. Petcher, I just, like I said, I was waiting for someone to table. I'm completely in favor of
Then I'll
consistency.
move number 6.
I think the point of discussion, Hans, is to have discussion,
Just
and that's what
discussion
we're doing.
so that we do know.
you know, and furthermore.
We're also informed when we, on both sides, when we get the legislative update on the budget and when we hear from our department heads about their needs.
Would you like me to talk about 6?
Yes.
Excuse me, I think
Could we
Mr.
move to put it on the table?
I think Mr. Petcher made a motion on HH6.
We have a second?
I'll second it.
Thank you.
Thank you.
I'll
We'll
second
start
the
with
discussion.
discussion from the department head.
Okay, so HH6. This is asking to fill 4 seasonal clerk positions in our heat unit because the heating emergency assistance program serves many people, thousands of people in the county each year. The reason that we have 4 seasonal positions come on board this time of year is so that they can, at first, they're getting the prep work done for all of the people that are on temporary assistance and receive SNAP benefits because based on their eligibility for those programs, they automatically qualify for it. They have a ton of paperwork to do. They have to match up to the different fueling vendors, make sure that we know where people get their fuel so that the trucks are going out to the right vendor to help with payment for individuals who are qualifying for help under this program. The heat program has really grown over the years from being a kind of a seasonal, like winter months assistance program to being a full year-round operation. There's a cooling component. There's a furnace tune-up program. I mean, it's going all of the time. And I think that my staff have done a great job of trying to absorb all of the new work and not have more staff added into the program, even though program has really expanded quite a bit. These 4 clerks that come in are busy for 6 full months. They work 35 hours a week. They are in, every day, taking phone calls, processing applications. We have an alternate certifier contract with the Cayuga Community Action Agency for individuals in the community to go to apply for heat. They do the initial screening, help people fill out the applications when they need to, and then they do some preliminary processing of that paperwork, and it gets sent over to the department to do a review and then to enter into the computer all of the data. It's very rigorous. It's very fast paced because there are certain timeframes and it takes place over a period of months. So these 4 clerks are really critical to keeping operations flowing and getting the money out. I will say that the funding that we get from this, these positions would be 100% funded through federal dollars that we receive for heat and through state funding that we get through heat. So they would be 100% covered.
The 4 clerks, do we have clerks now because of the situation with the county office building who were front facing, working with people who are now unable to do that and are available for work specifically in these clerk positions?
So right now I have all of my clerks are working. I have 56 people right now that I have scattered in different sites. I've got 34 workers working out of the old WIC space at 157 Genesee Street. And the rest of those, what would it be, 22 are in other departments, like scattered in other sites. So I got 56 workers that have actual stations to work in other departments. And I have 85 other people working remotely, mostly services and some other units, but my clerks are working. There's nothing has been relieved. This is very different than COVID, when there was a lot of relief around the standards of our operation as far as like seeing people, how we serve people face-to-face, recertifications, waive, things like that. We are full board operational. And, when we were first displaced from the county office building, yes, there was a bad scramble to get people the equipment they needed, to get people computers they needed. All of my staff have computers. All of my staff are working, but that's what it looks like right now. 56 are spread out between 6 sites and 85 are working remotely. So I don't have clerks that don't have work to do.
How many working remotely?
85.
85. Mr. Strong.
I'd like to make a motion to table this under the same reasons for HH 3, 4, and 5. Table HH 6 till such time the discussion needs to take place.
I second that.
Any discussion on the table? All in favor?
Aye.
Any opposed? Aye. And I'll explain my opposition. This is 100% grant funded. And we have talked about making sure that we, at least as we move forward, use our grants and make sure we take advantage of our grants, especially the 100% funded. The table carries. Christine, anything else?
I don't have anything else unless you have any questions.
Christine, I have a question. When's your heat program start?
Around November 1st.
November 1?
But there's the pre-work that I talked
Yeah.
about happens for a few months ahead of that.
Okay, so by the end of August, you need people in place prior?
Yeah, we typically have people come on board. Two of these people that we're talking about tonight would come in September.
Okay.
Two more would come in October.
September, October. So by the end of October, yeah, okay, I got you. Thank you.
Thank you. Brenda, thank you for coming up. Why don't we take a look at 8, 9, and 10?
So we have a retirement coming up in our office. One of our staff has been a case manager in our ISIC program for 18 years. So we're looking ahead. She is our only full-time case manager. She serves approximately 50 to 60 people over the course of the year. The individuals she served are considered nursing home eligible, but with a combination of in-home aid service, home delivered meals, personal emergency response pendants, assistance with transportation, benefits assistance. We're able to keep those individuals in the home, in the community, at a much lower cost than they would be if they were in a nursing home, which of course is typically paid by Medicaid at some point. The position will be in October, but I wanted to get this out there because we are looking for some continuity of care. We don't want anybody to drop the ball on anybody who is one of these older adults, typically lives alone, typically a woman, a widow, in her mid-80s, and very dependent on the service to remain safe and functional at home. So I wanted to get this out there in front of you. It is 75% reimbursed by the state.
Can I have a motion to put HH9 on the table?
Move it.
I'll second it for discussion.
Thank you. Any questions, discussions?
Madam Chair,
Yes.
I move table HH 9 for the same reasons we tabled the other ones. Till we have that discussion.
Second.
Thank you. Any questions, discussions on HH9?
When we, last month at the meeting, when we voted the table, we asked for 30 days to table in order to get the update that you've now referred to several times. It's my understanding that update's coming at Ways and Means in another week. And the next ledge meeting is after that point. And to continue to, hold up these resolutions today, which will have the update prior to our next ledge meeting, where the ones we tabled last month will be presented and most likely pass, I think is ingenuine, to be honest. I think it's playing politics. And I'm going to vote against tabling this resolution. So that's going to be me.
Mr. Strong?
My argument to this is that I'm pretty sure I brought up a considerable argument at last month's ledge meeting about tabling those positions. Made my feelings quite well known. I was outvoted. So I guess I go right back to the same thing. I don't know, I'm not playing politics. I'm playing, this is what the ledge voted on. And until we have that discussion, I don't see how we can hire any position until such time.
And
Have that discussion.
none of these hirings will be taking place because these resolutions cannot get passed until after that discussion occurs. So therefore, I'm gonna vote against tabling this one and proceed with the Office of Aging voting. I'm done. That's what I have to say.
So we have a motion to table
And second,
or on the table. Any more discussions, questions? All in favor?
I tabled.
Aye.
Any opposed?
May.
It carries. And you have HH 10?
This is a means of revenue diversification. So we look for ways to bring in revenue in addition to the grants funding that we receive. This resolution allows us to provide meals that we're already, purchasing for our delivery meal program. We then plan and provide these as a day program. And they reimburse us for not only the meal costs, but our overhead costs as well. We do have a couple different contracts like this with managed long-term care companies as well. This brings some extra revenue.
Move it, Mark.
A second.
Thank you. Any discussion on HH 10?
What's the price per meal nowadays?
You want to know? It's $7.25 is the actual cost of the meal. It costs us almost $12 to deliver it, process it, to do all the other parts of that.
Thank you.
Any other questions, discussion? Hearing none? All in favor?
Aye.
Any opposed? Carries. Thank you. Do you have an update?
Yeah, just a couple of things to add to what we submitted. We're happy to have the doctors that are here in Auburn, at the Auburn Hospital, doing their residency in rural healthcare, come visit with us. It was a wonderful conversation. They met with our health insurance counselor, and we're very impressed by the depth of knowledge and expertise that we can provide for individuals, especially related to their prescription costs and Medicare. And we also talked about the lack of aid availability in the community. In terms of, Medicare might pay for aid, it might pay for nurse, might pay for PT to come in the home, but those services are very lacking in Cayuga County. So it was a very enlightening and very just productive time. They were with us for 4 hours. We're going to have more coming. Another fellow is coming another day. And then the plan is for them also to go out and deliver our Genoa meal group, which is our longest meal group. So that should be very eye-opening. I wanted to mention also that our senior fair is scheduled for September 25th at the Finger Lakes Mall. And that is something that we do pursue sponsorships for to help offset the expenses for that. I also wanted to mention that our farmers market coupons, the first distribution will be Monday, the 15th out at the Finger Lakes Mall. We expect probably 400 people to come that day, that afternoon, to get their coupons. So we're going to have a number of staff out there. We're pretty organized. We've let the sheriff's department and the state police know because we had backups onto the main road last time. So we've modified the pickup spot, hoping to avoid that, but we're ready to go. I'm sure it'll be at least 90 degrees on Monday. Always is. That's all I have.
All right, thank you.
Thank you.
And finally, we have Deborah Dennis with our Youth Bureau.
I can give you an update on the one resolution I have this
Okay,
month.
thank you.
It's authorizing us to go into an agreement with just one agency. It's actually in Meridian, Idaho, the MIC Recreation Program, in the amount of $3,024, I believe that is. They had last year we did fund this program as well. It started actually today, July 8th, and it goes through the month of July. It does kids crafts, indoor, outdoor activities, and swimming as well. So it's just supplementing some of those staffing costs. That's primarily youth employees for the summer that work at that program. And also just to mention, this is OCF funding, so the amount of money that we would reimburse this program is reimbursed by OCFS as well.
I'll make a motion.
Thank you.
Second.
Any discussion on HH 11, authorizing the chair of the legislature and the director of the youth bureau to execute agreements with the said programs in Meridian, Idaho.
Yep, it's just their one summer rec program, but all 3 towns contribute to that.
No discussion, no questions? Hearing none, all in favor?
Aye.
Any opposed? Carried. Thank you.
And just other my update, I don't really have much, just to let you know with the distribution, we are receiving from New York State for 2025. We did, part of that funding is that new sports team funding that we received last year. The state legislature has approved that again for about $36,000 the second year in a row for specifically sports teams. So I will send information to everyone about that, because I know we have received some new applicants last year because of that specific stream of funding. That's all.
Thank you.
Unless you have any questions on anything else.
Any questions for Ms. Dennis? Thank you.
Okay.
Ledge 1 has already been discussed. We will be holding off on fixing the date, notice of that hearing, while we await some amendments to that local law as proposed by this committee. Motion to adjourn.
Move it.
Second?
All in favor?
Aye.
Daddy.
Okay. What are you doing now? Good days, bad days?
Yeah.
Friend of mine just had that done and she's in the
Well, shut up, boy, girl, boy, girl.
Yes, right. Okay.
I'm gonna call the meeting to order.
I spent $9 at Staples to get this stuff printed. We're still.
Gavel.
We're in the courtroom. Here comes the judge.
Here comes the judge.
All right, we're gonna call this meeting to order.
Remember the TV show with that?
Tonight we have Tom Winslow, Robert Shea, Lane Daly, Stephanie DeVito is absent, and myself. We're gonna start tonight with the district attorney. Thank you so much for being here.
Appreciate it. I have very good news, short news. So we did get our aid to prosecution grant funding again this year, which is great. It actually went up $30,000. So it's approximately $246,000. That's great. So we just have to figure out where that's going to be allocated in the budget, which is something that I have to sit down. Some of it was already figured out last year in a resolution, and there is some left over that we'll have to discuss where that goes.
So all the stipends that you were able to give can be continued
Correct.
without them falling off?
And there's more money, which is great.
Okay,
And then also, DCJS did indicate that we all are gonna get our discovery funding too, which I think is gonna be around 300,000. So we'll get that in as well this year, which is great news. So,
sorry, can I ask her a question?
Yeah, please do.
It's not in addition to what you have now. You'll be budgeting for it next year, is that?
yes, exactly.
Okay,
So it starts, I don't know the time frame, but I think it's supposed to be March to March or something like that. So the time frame's a little bit off, but we don't get the award letters until, I mean, it's early this year. Last year, I don't think we got it till September. So I anticipate getting the discovery letter sometime in September as well. But we did just get the aid to prosecution, which is great. So that's over $500,000 that's coming back to us.
And, okay, the other big funding stream you had was GIVE, or not big?
Give us about $100,000 for our office.
All right,
So not anything too crazy, but
Okay.
the discovery and the aid to prosecution are our big grants.
Okay, great.
So since the air's on, can you guys shout? And then if you don't mind, you have a big voice, but if you,
Talking to the mic.
Sure.
I tried to turn it up, so let's see if it's loud enough, so people can hear.
Okay. I don't know if I have anything else to add other than those grants.
I just won't speak tonight. That's been the play.
Okay.
Just fell asleep?
No, I said I'm not gonna sleep.
Oh.
I'm not gonna speak tonight.
Oh, I thought you said, oh.
Okay, I should turn this.
I don't have any resolutions, just good news with respect to grant funding.
Awesome.
Great.
Any other questions for Rick? Thank you.
Thank you.
All right. I'm gonna have Denise come up. She has to run and then we'll go to Dr. Duckett right afterwards. Thank you.
Good evening. Updates, not a lot, other than the backup center. So we purchased the laptops for the phones. Those did arrive. They arrived last Wednesday. The company, they're gonna arrive on site tomorrow. I'm gonna work with the vendor to get those all set up and have a network, and then we'll move them over to the fire department, hopefully tomorrow afternoon or Wednesday. So those will be done. The other item still kind of lingering is the radio PCs. We do have the ones borrowed from Oswego and Jefferson, but that was a short-term borrow. They do have some summer events that they're gonna need them for in August, so if we're gonna continue on this path, we're gonna have to purchase some because we've gotta have radio. We've gotta have access to a radio system. So I did ask for a quote on our own laptops for internal use. I haven't received that yet, so as soon as I do, I will make sure I get that out to the group. And then I have one resolution, which is JP1.
Can I get a motion to put JP1 on the table for discussion?
I'll second for discussion.
So this resolution was approved back in like October timeframe. We didn't have any viable candidates, unfortunately, so that's why it wasn't filled. And then we had a new test in January that we just got the results for, and the list just got certified in June. So when I went to fill it, she realized the resolution had expired because apparently they only last for 6 months, which I didn't realize. So this is one that was approved that expired because we didn't have anybody on the list to hire from.
Any questions?
This is a budgeted position?
This is, yeah, this is and the one that was tabled last month is budgeted as well. That was from an employee who had passed away. Very unexpectedly.
I had asked Denise, this particular position, she told me just now, has been vacant for 6 months, a good 6 months because of the timing of things. We do have the ability to look at the 911 position we tabled for the ledge meeting at the end of this month. I think for consistency, well, what's been going on tonight, I think we should, I'd make a motion to table this and then we could revisit the one position at the end of this month.
Second?
Yeah. Are we in discussion
Oh,
yet?
discussion, yeah, I'm sorry, yeah.
I think we need a second for the motion unless I missed the motion to, table.
First, we have a motion, a second.
A motion to second for discussion. Thank you. I guess, hearing that count one is going to be coming back fairly quickly next month, the one that was tabled last month.
End of this month, yep.
And we're not going to extend your time frame for one right away. Because you have one kind of, I guess, one is in the bank, it's out there waiting. They got tabled last month. So if we table this one, we're not pushing them both off till next month, as Jonathan mentioned, the reasoning or the circumstances from the prior committee meeting that's not happened. So, with you having one coming up again with the possibility of moving that along a little bit quicker and consistency of what the message the legislature has sent, I'm going to support tabling it as well.
The only thing I will add is the work is being done because it has to be done, but my staff's getting real burned out. We've had 44 mandatory overtime shifts. And if you talk to any of my staff, you'll hear it because they're not happy. It's summer, people want time off and they're being stuck day after day. I mean, every day there's emails going out with mandatory overtime.
How long does it take you to hire and fill a position, including the background, once you begin the process?
Couple months.
Okay.
The plan was to do a training class in the beginning. We're gonna start at the first week of September, but we don't have time for that now because I have to go through we have to go through the whole hiring process. And then we have to go through a background process. So it's about 2 months. And then it's a good year and a half before someone's fully trained.
All right, we have a motion, we have a second. All those in favor of tabling JP1? Aye.
Aye.
Any opposed?
I'm opposed.
All right, one abstention. The motion is carried. Any other comments?
I don't think I have anything else unless anybody has anything for me.
Anything else? All right, thank you, Denise. Dr. Duckett, welcome.
Hello, everyone. Dexter's not gonna be asking for a job tonight, so he already knows how that's gonna go. I did submit, I don't know, kind of the cross beams of how things got messed up, but we did send a resolution, but I just still wanted to come tonight just to talk about what it is because in the end of May, the Onondaga County Medical Examiners sent us our 2024 to 2027 contract. So it's hard to. So anyway, I did send it to Fred. I mean, it's pretty basic stuff. I read through the whole thing. Obviously the cost of services do go up every single time that we've seen every 3 years, about a few $100. We do go through and make sure that we are not wasting money and actually finding money. I mean, I always kind of remind that, a few years back, we had Marcia, that works with me as my administrative assistant. She realized that all the prison deaths, for example, are reimbursed by New York State. So she's in the process of getting all the 2023 reimbursements. So we try everything that we can to try to keep costs down. There aren't really any other options. There's not other medical examiners out there that are just beating down the doors to do this line of work. As I was talking to John today on the phone, I mean, a few years back, the entire country only graduated 46 forensic pathologists. We saw we did a recent study. Actually, I don't know if that's been shared. Me and Cayuga County, myself, participated in a statewide kind of evaluation of the medical examiners and coroner's offices and reporting of opioid deaths and things. And one thing that we found out, one of our big limitations is the fact that there aren't a lot of people doing this anymore, right? There's not a lot of places. So shipping out or trying to find things to send to a different county, Tompkins or wherever else is just not feasible. We've had a great relationship with OCME for the past 30 plus years. Every law enforcement agency in Cayuga County works with them. So I guess the easy part of this is, for me to say is that we really don't have an option. And fortunately it's not up significant. I mean, it's up a few $100s each service. A few years ago, they did already bundle the toxicology screens, which did years ago add a significant cost because when they began to see so many drug overdoses, they just began to bundle everything in with that because they just, it became so expensive. So that was probably the biggest leap that we had years ago with that. But other than that, there's really not much else kind of to go on, but it's just the 2024 to 2027 budget, our contract. Said Fred kind of rubber stamped it a little while ago and we sent it out.
So I spoke to Fred earlier. I don't have a copy of it. He's gonna provide me with a resolution and I'm gonna submit it for, it was supposed to be on tonight's agenda. He submitted it for last month. The guy's late. Right, to renew a contract. So what we're gonna do is I'm gonna submit it on behalf of Dr. Duckett for Ways and Means. And it can be looked at there. Fred said that's appropriate.
And it's an annual renewal. That's the
every 3 years.
Yeah, so as long as there's no objection from anyone on the committee, you guys are okay with that. So
you move the concept and it'll be presented at Ways and Means.
Are you sending far more people for autopsy than you were?
Actually, to be honest, it's down again. A lot of it's because, and I know some people may not like hearing this, we have done a lot of efforts in the community to decrease overdoses and such, but as a sheriff can, back me up with too, it's just the drug is changing on the street. So the drugs now are more the stimulants and they don't kill you, but they just mess your brain up. We've seen this even in my career starting off as a hospitalist at ACH, it was bath salts. I remember being in a hospitalist there and there'd be 4 exam rooms of people that were high on bath salts. So I think now that people are kind of into the stimulants, the synthetic mollies and the, kratom. I mean, it's not illegal per se. And you're seeing a lot more xylazine. We've seen xylazine for the past 8 years, but it seems to be another hot topic item. For those that don't know what xylazine is, it's used for horse tranquilizers, and people decide to take it. But we are fortunately seeing less, overdose deaths. Recently, we did have a house fire where somebody passed away. We had a suicide recently, and a couple suicides actually. But overall, the numbers are down from years past, but that's mainly because the things that really bumped it up were the overdoses, right? We were at 24 a year for 2 consecutive years and they're down significantly, but I'm optimistic on that.
Any other questions for Dr. Duckett?
Any questions for Dr. He's the first, I think, year old to be at a legislative meeting, so this is history.
Anybody else? All right, well, thank you.
Thank you very much, guys.
Thank you.
Yep. See you later.
See ya. Tyrone.
Not a whole lot this month, probably next month, but not this month. We're fully staffed now, but unfortunately that's only going to last for a little bit. My principal typist just told me she's going to retire in August and I have a supervisor retiring in mid-September. So those will be positions that I'll be looking to try to fill down the road here. We purchased we got the clear contract and we've been using that. We've been able to find a bunch of people, starting to get the restitution payment. And people are now somehow finding that, oh, I do owe this money.
That's great.
So we're starting to get some of that in, so that's good. Doing some annual research, Town Firearms OC, this month. When I was at the conference, the directors conference, talked to the company that does our electronic monitoring about scram bracelets, some kind of, it'll actually monitor alcohol for use. It's a self-pay, and it just gives us another sanction. Instead of incarcerating people, maybe we can give them other chances by putting them on this bracelet. So we're gonna further look into that. The ATI Advisory Board met in June. We'll be looking to meet again in September. And then our annual state aid plan, the ATI grants and the RTA grants have been completed. We've already got our approval for the ATI already. Or pre-trial, one of the two. I'm all confused, but we got an approval for one of them like right away. So that's good. And hopefully, if I did these correctly, we'll be hearing everything. Good stuff. So I'll be looking at getting some vests next month, just looking at our finances and seeing where we are, where we can move things and do some things. But I think if we start with 3, then we can kind of look where we are. Continue to look as we go down the year. Other than that, that's all I got. I do have our Caseload Explorer, which is our case management system, is expiring. And we just figured that out. Because they actually sent the bill and the contract to Jay. And so when they finally figured that out, it's due, well, it's going to expire, I believe, maybe the end of the month. So with Fred and Tom, trying to get all the proper documents, and because it's a new, the auto mine got bought out by like a different company, so we have to go through and get another resolution and so forth to contract with that company, and trying to get the wording right in it.
Is that where you send all your statistics through?
It's the case management system that everybody uses in the state, and then communicates with e-justice and every other system that the state requires us to use. So it really nothing, it's the same system. It's just a different company that owns it. So we'll be working on getting that together, getting that contract, and hopefully I'll have a resolution next month for that.
Okay, thank you.
Thank you, Tyrone. Anybody else? Questions? All right, thank you, Tyrone. Riley, how long are you gonna be?
I'll be brief this evening. I have no resolutions. Just a couple of operational updates I wanted to provide to everybody. We've had a busy start to the summer, busy start to the year. If you weren't in attendance, we had no incidents of significance at the July 3rd fireworks. It was a very positive night. It was a very fun night. We seem to have very good response when it came to that. We have another large event that will be happening next week in Aurelius at Patterson Farms on the 17th and the 18th. That is the North American Manure Expo. Representatives, agronomists, farmers, soil scientists from Canada, Mexico, and the US will all be congregating at Patterson Farms. And they'll have safety features, demos, vendors, you name it. There's quite a lot to be said about a manure fest.
What's the estimated crowd size for that event? Do you know?
On
the high side, they thought about 1,400.
Yeah.
Oh, okay.
1,400 if it's well.
Oh, that's not too big. Okay.
It's big as far as
Manure.
goes. We'll spare the judge for right now. A couple of operational updates. We're about 6 months into the year. We're right over that at about 190 days. I just wanted to provide the legislature with the update that we're sitting at about 102 calls dispatched out of my office, including, as of yesterday, 64 potential or working structure fires. That is a significant change to last year. Last year, we saw 149 calls, period. And now we're sitting at 102 at the 6-month mark. Within that, we've also had a significant uptick in requests for our fire investigators to respond to those. We saw 37 times where our fire investigation team went out last year. We're already sitting at 22, where they're assisting with the investigation of cause and origin of structure fires. By New York state law, that's the responsibility of the fire chief or the incident commander for that scene. But oftentimes it stems well past the basic level of training that's required of a fire chief based on their own jurisdiction. Within that, we've also had just in the last week, so since I gave you this report, we had 5 structure fire calls in this county. We had a fatal fire in Victory, if you didn't read that in the Citizen. We had one in Moravia, one in Summer Hill, a barn fire in Genoa, which was limited to 1 bovine fatality. And then we had a potential call that turned out to just be a burnt stove in Ira. But nonetheless, we're on an uptick when we're seeing 64 fire calls year to date. We also had 3 water emergencies, 2 potential drownings. They turned out to be false activations, as well as 1 emergency that involved a person who was hurt on a dock and there was no way to get them up the steps on Wasco Lake safely based on their injuries into an awaiting ambulance. So we required a water rescue for that. So again, we've got a lot of trainings going on beyond that. We're very busy on the call response side of things, but I just wanted to provide the legislature with the update on kind of where we're sitting 6 months into the year when it comes to responses. And that's my 3 minutes. I think I held to it, Tyrone. And are there any questions for me at this point?
What do you contribute the uptick to in the, I mean, we're not through the winter season yet. What do you contribute it to?
So there's a number of contributing factors. We're seeing a lot of community risk reduction efforts only go so far, but we're seeing a lot of things are contributed to vehicle failures within buildings. So you might have a car fire inside a park garage. That's actually what was originally transmitted for the Victory fire this afternoon. And then it was originally called in as a truck, turned out to be a tractor fire in Genoa yesterday. So we're seeing a lot of vehicles improperly disposed of flammables, people that are working with linseed oils, varnishes, other flammable content and just tossing them into a trash can. And then later they spontaneously combust, as well as continued failing infrastructure. You've got old barns, old houses, exposed electric lines, and then you're seeing weather fueled advantages. We get some of these high winds that we've got coming through and they just create a funnel for a small electrical fire. I mean, some of them have even gone back to birds' nests that have caught on fire in wire boxes. And as soon as you add a little bit of wind, you're just adding quite literally fuel to the fire. So it's a number of factors that go into it without delving too far into the fire investigation world, but we're seeing just this continued uptick. And when we're sitting roughly 25% higher call volume at this point in the year, that's something to just note at this point.
How much time does it take you to, I mean, I know everything's different. Sometimes it's a few hours, sometimes it's days, but on average, what amount of time does it take for your investigators to close out a case and write the report?
Well, you hit the nail on the head. Based on the presenting evidence, you're seeing it can run anywhere from a few hours to it could be 15 hours, multiple returns to the scene. And it's all based on what's left at the scene after mitigation efforts have ended. There's been a huge effort nationally to try and attempt to encourage firefighters in their efforts to preserve evidence as much as possible. I'll be politically correct when I say firemen can be a little over the top when it comes to overhaul, and everything goes out of the house, everything gets torn out, and that doesn't leave a lot of
Evidence eradication.
Let's put it that way, evidence eradication. And so, or if you have a house that's been fully involved on arrival, there isn't an awful lot of material for them to attempt to work with. I am fortunate, we just put 2 people through a fire investigator's course, a volunteer and then one of my deputy coordinators. They both passed their national certification exams at the New York State Academy of Fire Science 10 days ago. But they will now have to go through effectively a probationary period with the state of New York where they're required to do 20 hours under the mentorship of an existing approved investigator.
Congratulations to them. I know that's not an easy task and so multiple classes and multiple weeks to get there. So
And a 4-week process.
a lot of hours between 1 and 2 to get certified. So
luckily, one of my guys is retired from his full-time job, and he's got about 4 other hats that he wears besides, but he still made time for this. So again, just bringing that to light to all of you at this point. Any other questions?
Yeah, I got just a couple of, no real questions. When is the next LAPC meeting?
LAPC meeting is scheduled to be the first week of August, I believe. And we presently don't have minutes because they're in Rusty's office.
All right, if you can just send me a reminder.
We will attach it to, and Chairman Anna to that.
And on the fire investigation, you kind of answered what I was going to ask is, with 2 more people, if you've got a decent amount of people for.
We do,
amount of
but
investigators.
we only have 3 investigators currently. We have one that has been doing it for decades and does it professionally. We have 2 more that assist, but they also have their own respective full-time jobs. And the volunteer position, be it what it is, that was to get her through the academy. Our investigators are currently only stipended at $1,685 a year. That's $1,685 a year plus mileage.
They're all volunteer basically, right? Part-time, but their stipend, it's
Essentially, they're stipended to a matter of less than $2,000 per year.
It was always tough when I was more involved with.
At one point in time, the team had around 10 people. There used to be a position called an apprentice position that ceased to exist before I came to the office. But they've hovered right around that 3 to 5 margin for the last, I would say probably 5 years. I mean, Mark, you could correct me if I'm wrong.
No, you're absolutely right.
There's the fire service in this county, the team kind of hovers at that 3 to 5 margin, which is why I'm trying to utilize deputies to creatively solve the problem here. Anything else?
Thank you, Riley.
Was it 3 minutes?
I know Lloyd's not here, so come on up.
Evening. It's nice and short. You have our reports, once again, provided with, information from CAP, Rainman information that's, in line with, how the trends have been going in the past few months. Same with our expenses. That listed out through May. Other than that, no major changes, no resolutions.
Any questions?
Pretty quick and direct.
We like second time, we'll take it.
All right, thank you.
Thank you. Zink, you want to come up for a couple minutes?
Tell me he doesn't have to.
All right, you don't have to. That's okay. Sit tight. You don't have to come up here.
It's all on you, Zink.
It's all right. You don't have to. You're here. I just asked. You don't have to. I can move on to the
He's
sheriff.
just trying to be polite.
Yeah, you don't have to come up.
Well, you asked me a question.
I saw you sitting here, so I'm like, hey, if you want to come up, feel free.
He's thinking leave him alone.
I was going to, but.
What do you want to know?
You should have just said, leave me alone.
Very quickly,
How long made it over the plate?
this is a good season weather-wise to schedule events throughout the community, and we just had a very successful event down to the Double Days Park on the 29th of June. Of course, it was a ball game, baseball game. And through the interaction and the invitation to Brian, Sheriff Brian Skank and Under Sheriff Stu Peenstra, interacted with the crowd, and I was overwhelmed with how well they just kind of floated around the place. Also with Jonathan, it seems like it was just meant to be because I think what we did is we enticed the people to be interested in us as far as the Stop DWI message. We used a thing called a shotgun, a shirt shotgun. So all those shirts that I ordered that are branded with Stop DWI branding, we rolled them up. You have to roll them up a certain way to get shirts in this, the barrel of the shirt shotgun. And I think Stu thought he was on a hunt because he was going around that particular outside of the stadium, closer to home plate. And they were just shooting these shirts up into the crowd.
There's a picture, Zink, that's up right now. I don't think I've ever seen that happen.
I know. He was having way too much fun, wasn't he?
I want to know who was the better shot, the sheriff or the undersheriff?
Well, Stu was the only one. He didn't let anybody else shoot them.
Oh.
He was like, he gave him.
My toy.
Yeah.
And when they came over to the third base side, he was shooting them up there, and there was a couple way up on the top of the stands sitting there watching the game, of course. And they apparently are season ticket holders, they go to all the games. And Stu shot the gun off, and this guy caught it. A kid down below him goes, "Oh, geez, Dad, I wanted that shirt." The guy got up, went down there and gave the kid the shirt. The shirt was too small for the kid, so after he tried it on, he took it off, he gave it to his brother. So there was one kind act for another. So I went up to the gentleman that gave away that shirt initially, and I said, "That was very kind of you to do that, because as you see, your kindness kind of prompted the other kid to give it away also." So I said, "You guys gonna be here?" His wife and himself. I said, "You gonna be here to this game over the weekend?" He says, "Yeah, we come to all of them." I says, "I got a shirt not only for you and for your wife also. But just tell me what sizes you've got to have." So I did that, and of course it made those people very, very happy, and it was just a nice gesture. And we're spreading our word about don't drink and drive. We're here to save lives. And legislator Anna and his son Ethan were there, and Ethan was having a great time just being in the crowd and watching the game. And in between the innings, the old days try to entertain everyone, and they do a really nice job. It's very simple, but it's you're spreading the word of goodness to the next generation, what you should be doing as far as the humanity of each other and enjoying each other. So we did that, and we've got another one, Jonathan, scheduled for in Ryan for end of the month. Okay. I'm going to have to say something that I didn't want to, but I invited the New York State Troopers for that night. They didn't show up, which is okay. There's things that happen. And APD never got back to me. And this whole thing is right in their backyard. And I was kind of disappointed, but I'm not going to, raise a red flag here. But I thought maybe we certainly see, Judge Slayton and the undersheriff or the assistant sheriff, or deputy sheriff, rather. Deputy police, what do you call those guys?
Chief.
Second in charge. Oh, yeah. In any event, I thought I'd see them, but they're busy, so things happen. So I'll keep hounding them until maybe they say, "Okay, we'll be there." Because in the past, as you know, Brian, the sheriff department, New York State Troopers, and Auburn Police would drive the cars down there, and you guys would line them up to the entrance of the field, and the kids would see them, and they'd go over and handle them a little bit and look inside and pique their interest, and they got to pay attention to what the police vehicle looks like inside. So I think it's a good thing. And it's a lot of fun. We've got signage all over the field, out in the outfield that we've paid for, in addition to that part of the stadium right behind home plate. So Stop DWI is consciously making people aware of who we are and what we're attempting to do. So we'll keep it up. It's fun. People are interested in it, and you would think that, oh, it's Stop DWI type stuff, but you know, as soon as you get their attention, they're very positive as far as their reaction to it, and very, very supportive. But you can't do things like that unless you have guys like this gentleman here, the legislator, and our other police and our Cayuga County sheriffs and New York State Trooper being part of it. It's just a wonderful feeling. And thank you so much again.
And I invite any members of the legislature to come out and enjoy a game. Come on, our attorney can join us too, but come on out and take in a double day game. It was a good time, you know?
I have tickets. I have free tickets.
Come out for Stop the other night. Have a good night.
But from our budget.
Oh, yes, you go ahead.
And I'll stop.
Yeah.
We get a budget from, there's a great picture.
I got it across that's Zink. He just asked me, he goes, did you throw out the first pitch? I said, I did. He goes, did you get it across the plate? I said, you better ask Zink.
You did it.
I did it.
Yeah.
So, the sheriff set me up. He says, you know, you're gonna have to, you know, he goes.
Blazing strike, you threw it right in there.
Well, it was a little high, but it was over the plate. So.
Okay, thank you.
Well, thank you very much, Zink.
Yeah.
All right.
All right.
Was fun though. Be like a ledge night out.
Good evening. With that, I think next month I should introduce a resolution to purchase a t-shirt cannon because it was a pretty good time. No, it was a lot of fun. We're glad we could be there. I don't have anything additional to offer other than I would like to say relative to our board and revenue, I do try to report each month as to what we have in the jail, what we have for borders, what our population is. I've been in regular contact with the marshals to try to get that number of federal board-ins up. It's not coming as quick as I would like. I think that having 35 regular board-ins from the feds is over with the limited number that there are now available, the number of sheriffs that we're competing with to get this board-in revenue. That's a thing of the past, but I am still working on local sheriffs as well. We do still have 7 from Jefferson County. The sheriff is contracted with us to have them here. I am still working with the Tompkins County Sheriff. I mentioned previously they are doing a remodeling project to their jail. So I anticipate getting about 30 or so incarcerated individuals from Tompkins once they start that project, but they've been delayed until October. So we're not going to meet our budget revenue number, but I think that will ease a little bit of the pain if we can get them in October for a few months. So I will continue to keep working on that to raise that revenue. That's an important part of our budget. I don't have any other additional updates beyond that. Happy to answer any questions before we get into the resolutions if you'd like.
I meant to ask you a question earlier today when we spoke on the phone, and I apologize for forgetting about it. The question came up and I didn't know the answer, and it was asked of me. When you have inmates in the facility and they're either federal inmates or out of county inmates, do they receive the same counseling and the same services that you provide in county? As far as the programs go, they get the same programming?
They do. So our reentry program, it's funded through a grant. They receive those services. And then we are obligated to provide medical or mental health treatment, just like we would for anybody else in our facility. We do back bill prescription costs and any outside medical costs we have, so we don't bear those, but we do have to offer the same services that we would offer anybody else in our
But
facility.
if you gotta do a transport to a hospital or sit on somebody one-on-one or have drugs administered through a prescription, that's outside of that $75 or $100 a day, that would be billed to the agency or whoever sent them to us.
Correct. We bill that in addition to the agents.
Okay, thank you, Sheriff. Anybody else for questions? Okay, we have two resolutions, JP2 and JP3. We'll do them one at a time. Can I get a motion to put JP2 on the table?
Move it.
Okay. Can I get a second?
Second.
All right, I'm gonna make a comment about this one real quick. And I just want to say thank you to the sheriff for this as well and express my public support for JP2. back when this first came to light, it was off of ARPA grant. I'm sorry, it was not ARPA funds. It's off of. No, it's ARPA funds. I'm sorry. It's unrestricted ARPA funds. That was used for this, and originally the ask was for 200 and the county's share would have been 100. When I spoke to the sheriff over the winter, I asked him to see what we get that down to, and I just want to say thank you. We got the county shared under $70,000 at 60 something for this boat, and I just want to say thank you for working with us on that. And I put this resolution for this boat. Any other comments or questions about JP2?
Can I make one quick comment about the resolution?
Please do.
Mr. Chair. Our emergency services director expressed some interest in trying to procure the boat that we dispose of. I'm not sure if that's a feasible option. He can certainly make his pitch. It's not, I told him it's not a boat that you can operate all the time, maybe as a backup or something, but it's getting tired. That's why I'm replacing it. But he is interested potentially in exploring it, much like we've distributed cars to the probation department. But I understand he may have some navigation assets that he could possibly use the used boat to replace. I'm not sure, but if it's all right with
If you'd like to, Chairman.
Please.
I'll just follow that up. No, echoing the sheriff and trying to recycle or trying to continue getting just a little bit more useful life out of assets. We presently have water rescue assets stationed throughout Owasco Lake. However, they're primarily focused to the northern end. Fleming, Owasco, and then Scipio all have boats. Moravia has a small inflatable craft known as a Zodiac. In the event that there was an emergency at the southern end, it'd be the expectation that that Zodiac would be a primary response vessel. That is a donated vessel that came out of private ownership that was actually gifted to the Moravia Fire Department. In conversations with their chief, they have a less than ideal outboard motor on the back of it. It's not prone to failure, but it's not always consistent. And we attempted to try and reach a solution where we would take one of our 4 Zodiacs. We have 4 in the county that were purchased off of a grant almost 12 years ago, which is the required minimum for a swiftwater deployment team. One of those failed 2 weeks ago.
Is this for drowning?
This is for drownings and water rescues.
Okay.
And so where the sheriff presently uses the boat for regular marine navigation and patrols on the lake, my suggestion would be that we could transfer it to the office and we would have it available as a backup emergency resource stationed out of Moravia or at the southern end of the lake, perhaps actually at the only marina that has waterfront slippage. And that's where I'd like to see this, just to better serve citizens in the southern end of Owasco. It wouldn't be a regular patrol vessel. We see about 12 water-based emergencies in a year. But in the event that we actually have a drowning, those can go on days into weeks, as we all know. And having that available as an asset through this office, we can eke a little more life out of it. It would drastically save us trying to come to you with a similar grant proposal a year or 2 from now if we were trying to go down that same road.
What would you normally do with it? Just put it in auction?
We would auction it. I can't tell you what the value of it would be
Yeah.
tonight. I mean, it's something we could research to
There's
get
not-
more information.
Right.
There's nothing, I'm sorry, I don't have the resolution right in front of me.
Here it is.
There's nothing that,
It just goes back to the clerk.
yeah, but there's nothing that says
we have to.
how we're gonna dispose of it or anything.
No,
It's just-
Nope, not at all.
We're talking about the
There's a policy that the county has that deals with asset disposal. I don't have it at my fingertips, so we would need to consult that.
Previously, we took possession of a trailer that the health department had purchased off of a grant and we put that into service. It was a vaccine trailer, a mobile vaccine clinic. And we've since relettered that and outfitted it for low cost, all out of department expense as a extended deployment trailer that can be backed up to mobile.
Possible.
Yeah, but I would think once we follow
Yeah.
past policy as far as
Yeah.
transferring equipment from department to department,
Yep.
similar to like you mentioned, the patrol cars to the,
Just need to dot the I and cross the T.
yeah.
Did you want to, is it the Boston Whaler you want to stick with? I know we talked
So-
about possibly changing boats.
I did speak to Chairman Anna today about the fact that Lieutenant Sloan with our department that oversees our navigation patrol had indicated to me today, assessing our Key West boats that we have, he might recommend that one of them be replaced instead of this one. So I might seek to amend the resolution at the full ledge meeting just based on the condition of our boats. I think he's found that in looking further at our boats, it might make more sense to get rid of a Key West just due to the condition of that versus this boat. We might be able to get a little more life out of this.
So you're okay leaving it alone tonight? We'll revisit it later.
I need a little bit more information from Lieutenant Sloan, and then I will get with you before the full-fledged meeting.
That would be replacing the boat you want, or changing the boat you want to get rid of.
Correct. We're still going to replace a boat regardless. We're not looking to add a boat. It's going to replace one, whichever one has the most wear, we want to replace.
It would.
I don't care. I just want a hard body fiberglass boat versus an inflatable Zodiac.
I got you.
If you're going out in the dark in any way, shape or form, having navigational equipment versus a literally a 12-foot Zodiac boat, I would much rather have a hard body boat. So I have no preference. I support the sheriff in whichever path he takes.
He just had to bring a resolution, like a request, or go through procurement. Right?
Or through
Go
procurement,
through
yeah.
procurement. See Amanda.
Sheila.
Oh, Sheila.
Yeah.
Okay.
And also I was asked by this committee at the last meeting to come with costs to upfit the boat. The boat comes from Metalcraft Marine with all of the light bars, the lights required to do our law enforcement patrol with it. The only thing that we would have to do is switch out the mobile radio from the current boat to this one and letter it up with our lettering on the side of the boat. So that would be approximately $2,000. I did ask for this resolution not to exceed $130,000 with the cost of the boat, I believe, being $125,600 with us covering half of that. So I just put a little bit extra in there to make sure that we have enough to transfer the radio and decal it, but I don't foresee that it would go to that amount. I think it's going to be more like $2,000 or $3,000 versus nearly $5,000.
Any other questions on JP two? All right, we have a motion and a second. All in favor of JP two?
Aye.
Any opposed? All right, so carried. JP three is pretty basic, right, Sheriff?
JP3, correct, yes, we've addressed this a number of times over the last few years, the state unified court system that funds our court security officers with a 100% salary reimbursement is authorized another $1 per hour raise for that division. They would pay that completely, that would come from the state. Like every division, we're having challenges recruiting for that division, and I welcome the increase if the state is willing to authorize us to do that.
I'll make a motion for that.
I'll second.
Okay, all in favor?
Aye.
Any opposed? Great. All right, anything else for the sheriff?
Thank you.
Thank you, Sheriff. I believe that's the end of our meeting.
Oh, yeah. Can we just fill in the minutes?
Oh, we never approved the prior minutes. I'm sorry. Thank you for that. This is what happens when I don't look at the agenda. All right, I need a motion to approve last month's, approve the June meeting.
June 5th.
June 5th meeting. So, all right, I got a first, I got a second. All in favor?
Aye.
I need a motion to adjourn.
Second.
All in favor?
Aye.
Aye.